Having an ectopic pregnancy is one of the most heartbreaking tragedies to go through. What an ectopic pregnancy is where the baby, while on its way to the uterus, implants itself and begins to grow inside the fallopian tube. Dr. Steele of Cleveland Clinic says that 1 in every 80 pregnancies are ectopic. So overall, they are a rare form of pregnancy to be worried about. Some symptoms to look out for before deciding whether or not to go into a doctor's office are vaginal bleeding, lower back pain, bloating, and cramping near the pelvis and around the uterus. This is diagnosed by 2 ways. One being the use of a transvaginal ultrasound to look for loose blood inside of the pregnant woman's stomach. The other is the checking of the pregnant woman's HCG levels. These are her pregnancy hormone levels. The way that they use these is how many hormones are present for how far along the pregnant person is, and whether or not the levels move up to where they are supposed to. There are 2 methods of treatment for this. Both of them, unfortunately, result in the death of the baby. And the first method is medication in the form of a chemotherapy drug called methotrexate. This is a fast-acting drug that rapidly disintegrates fast-growing cells, such as the corners of your mouth, cancer cells, and the baby growing in the fallopian tube. This shot is given in 2 doses in both buttocks. The patient then has to come back 2 weeks later to get their HCG levels checked. If they have not dropped down to where they need to be, a second dose is recommended. The drug is inside the patient for the next 3 months. According to the American College of Obstetricians and Gynecologists, during this time you must avoid heavy exercise, sexual intercourse, alcohol, folic acid, foods that produce gas, and long exposure to sunlight. This treatment is for when you catch the ectopic pregnancy earlier on before rupture. The second method is surgery on the fallopian tube. The surgical route is most often taken after or just before the tube is about to rupture from the baby's growth. This can result in 2 different endings. Either the pregnant tissue is removed and the fallopian tube is repaired, or the pregnant tissue is removed and the fallopian tube is removed as well. Whether or not the fallopian tube is removed depends on a number of factors. Dr. Brian Levine says that it's based on the condition of the tube, the size of the ectopic pregnancy, and whether any bleeding is present. The healing process for the surgery is also extremely brutal, not even mentioning the emotional trauma and stress that has on all parties involved. I know this because I recently have experienced this firsthand. The night of January 9th, me and my girlfriend Evelyn found out we were going to have a baby. After 2 amazing days, we started experiencing complications with our pregnancy. There was abnormal bleeding and cramping near the pelvis. We then decided to go to the emergency room, where they sent us to Cleveland Clinic in Akron. There they took a few blood samples to determine Evelyn's HCG levels, and then told us to come back in 2 days for another drawing. We came back 2 days later, and they told us that we were either miscarrying our baby or that we had an ectopic pregnancy. We then had to come back 2 more days later to determine whether or not it was a miscarriage, where in this case, even though it is horrible too, was the better option for our scenario. They told us because our HCG levels had dropped, but not to where they needed to be, we had an ectopic pregnancy. That night, they gave her 2 shots of methotrexate in both buttocks, and were told to stop back in 2 weeks for a checkup, and had to come in and get her blood tested once every week for the next month. We thought that it was the end of this horrible nightmare, but 4 days after she got the shot, she woke up with terrible pain right where her left fallopian tube was. I rushed her to the emergency room, where they gave her fentanyl for her pain and a 30-minute ride to the Cleveland Clinic in an ambulance. There, she underwent emergency surgery because her fallopian tube was being ripped up open by our baby and she was bleeding internally. After a grueling hour-long surgery, I was able to visit her in the recovery room. They told us that her fallopian tube was too far gone for repair, so they had to remove her tube along with our baby. She threw up constantly on the way home from the hospital. The next few days, she was barely able to walk, spent every moment in excruciating pain, and could not even use the restroom without help. She needed pain medicine every 3 hours, so I stayed up to make sure that she always was getting what she needed to reduce her pain in any way that I could. After 2 weeks, she had made a full recovery physically, but mentally we have barely been able to function for 2 months later. Currently, there's no way to relocate an ectopic pregnancy once the baby is implanted inside the fallopian tube. Even though the chances of this happening to anyone are slim, the effects of this tragedy are incomprehensible for all parties involved. Thank you for listening.